I just have to say, it just occurred to me that before you proceed, really, if you were to go down this route, you really need to check, I guess, if you are allergic to this product, the barrier cream. I don't have any allergies, but I can see the possibility whereby somebody is allergic to it, and then you use it, and the outcome is disastrous. So you really have to take precaution. Again, I have to inform you that I'm not a medical professional, and it's you try this out at your own responsibility, really. So once you have filled in the syringe about 3-4 centimeters in, you've set your how far you're gonna go with it. You lie down on your side. You put a bit of Vaseline around, and then you start very slowly inserting it in your anal canal. Slowly, because this end here can be a bit sharp. So once you've reached your depth, which you know because your elastic band which will reach your anus, you stop. It'd be good to know whereabouts. It's not only the depth, but also whereabouts around the anal canal, the internal opening is roughly at. So you can direct the syringe in that direction, and you slowly then push the plunger. You'll find some resistance because while you're pushing, some air will need to be displaced. So you go slowly with that rather than fast. You have to be careful once the plunger exits the opening here. The plunger itself can be quite painful if you push it too hard against the anal canal. So you have to be really gentle and be careful when the plunger exits the syringe. At which point, then you very slowly retract the syringe from your anal canal. What I then do is I would put some toilet paper as well, just to block the cream coming eventually out. So I've been doing this for about 2 months. I must say the initial result, even after the first day, was phenomenal in the reduction of pus and pain. Of course, that has got its ups and downs during the treatment. So, don't be put off by the fact it might seem miraculous day one, but then it kind of deteriorates again. But I think over time, what I've noticed is that I've got less pus. What I've also been doing, though, in conjunction to all this, is I've been using my hot water bottle. So spending quite a lot of hours sitting on it and renewing the water when it gets cold, even sleeping with a water bottle, especially, if you are in contact with it overnight. I found that's really good for a good start in the morning. And the way of doing that involves, I don't know if you're aware of, there's these incontinence pants. So I wear them over my underwear, and then I insert the water bottle between my underwear and the incontinence pants while I'm sleeping. It takes some getting used to, but it's really helpful if you can keep that area warm overnight. And yes, people will argue that the water bottle gets cooler during the night. However, if you get that area covered, it will be slightly warmer than it would have been without it, because at the end of the day you lose heat from your extremities. So it's always, I always feel great in the morning doing that. So these two approaches, the hot water bottle and the barrier cream, over 2 months have reduced the amount of pus. What the changes I'm really seeing is that apart from the amount, the pus is getting more runny, so the viscosity is reducing. and it's less milky. So I think that has made a huge difference at the levels of pain I'm experiencing while I'm sitting down, because you can imagine there's effectively less pressure by the pus being less dense. One other thing to note, I guess, is that in the morning or wherever, or at night, or whenever I feel pain, I always try to squeeze the pus out. So in my case, I've got an idea of how the fistula tract is along the body, so I can press along different lengths of it and I can get pus out. So I've been doing that consistently. A tricky thing with all this is that there's been a number of times, especially after a month, whereby the external opening closed, and that can be really tricky because you still get pus, and if you don't do anything about it, you will get another abscess. So my answer to that, and again, then proceed at your own risk, was to get some sterile needles, and then I use disinfectant on the area, and then I just scratch. I'm not pushing the needle in. I'm just scratching the surface of where the external opening of the fistula was, and it's just I don't get any pain because I don't think there's any nerve endings there. It's just scar tissue, and I just scratch until the point whereby when I push, I can see the pus still coming out. So I've had to do this 3 or 4 times already. I think it's an indication that the whole process is working. However, you have to be aware that it might happen and you have to be ready for it. It really freaked me out the first time I did it. I wasn't sure I knew what I was doing, but it was all right. But you have to use disinfectant and keep that area clean, and one-use needles really, and it's just scratching rather than pushing the needle in. Anyway, that's my experience. I don't know. I mean, maybe I'm just, I don't want to think that's necessarily all it is in treating this, but it's definitely improved my quality of life, and I hope it does that for you too. All right, take care.